All right, well, welcome everyone, and thank you for being here. I'm Dr. Shin, and today's discussion is centered on why cardiovascular prevention matters. So, when most people think about heart disease, go ahead, what's next? So, when most people think about heart disease, they picture someone having a heart attack out of nowhere. But the reality is that heart disease usually develops quietly over the decades. Plaque can slowly build in our arteries long before we notice any symptoms. And cardiovascular disease still remains the leading cause of death. But the encouraging news is that many heart attacks and strokes are preventable. In fact, many people who experienced their first heart attack felt completely healthy beforehand and had no warning symptoms. That's why prevention is so important, and we want to identify risk factors early and intervene before symptoms or serious event ever occur. One of the biggest reasons we focus on cardiovascular health isn't just to help people live longer, it's to help them live better. Research consistently shows that healthy lifestyle habits can add years to your life, but more importantly, they add healthy years. We call that health span, the years you're able to stay active, independent, and enjoy life. Instead of spending the last decade of your life managing chronic illness, our goal is to compress that period of disability into as short a time as possible. Heart health affects much more than just your health or just your heart. Better circulation means your brain receives better blood flow, your muscles get more oxygen, and your cells function more efficiently. Patients often notice improvements in energy, mental clarity, mood, exercise tolerance, and even sexual health when they improve their cardiovascular health. Studies like the FINGER trial, Finnish geriatric intervention study to prevent cognitive impairment and disability, also show that healthy lifestyle changes help protect cognitive function as we age. So we're supporting both heart health and brain health together. And sometimes people think they need dramatic changes to make a difference, but small improvements can have a surprisingly large impact. For example, lowering blood pressure by just 10 points significantly reduced the risk of heart attack, stroke, and heart failure. And regular physical activity, about 150 minutes per week, can reduce overall mortality by around 30%. So these improvements add up over time. You don't have to be perfect, and you just have to really work on your consistency. And a standard cholesterol panel is helpful, but it doesn't always tell the whole story. Someone can have a normal LDL cholesterol level, but still have significant inflammation or a high number of cholesterol particles, which may increase cardiovascular risk. That's why we sometimes recommend looking deeper. And so ApoB is one of the most useful markers we have because it measures the number of cholesterol containing particles that can actually enter the artery wall. Rather than just measuring how much cholesterol is being carried, it tells us how many delivery vehicles are circulating. And more particles generally mean more opportunities for plaque to develop. And ApoA1 is the main protein found on HDL, often called good cholesterol. It reflects your body's ability to remove excess cholesterol from the arteries and transport it back to the liver for disposal. In many cases, ApoA1 gives us more useful information than HDL cholesterol alone. And certain ApoE variants may influence how someone responds to dietary fat or their lifetime risk of Alzheimer's disease and cardiovascular disease. Knowing this helps us tailor recommendations rather than taking a one-size-fits-all approach. ApoE2 is neuroprotective, whereas ApoE4 can increase cardiovascular and neurodegenerative risk. And most common one is ApoE3 that means you don't really have increased risk or protective um, measure. Oops. And these markers give us insight into how healthy the lining of our blood vessel is, especially the ADMA and SDMA, which is a marker of endothelial dysfunction. So healthy blood vessels produce nitric oxide, which helps them stay flexible, and it also maintains good blood flow. And elevated ADMA can interfere with that process and may signal early vascular dysfunction before disease becomes obvious. Oops, I keep going back. And myeloperoxidase, or MPO, it measures the active inflammation within plaque. And not all plaque is equally dangerous. Some plaque is relatively stable, while inflamed plaque is more likely to rupture and cause a heart attack. So MPO helps us identify that additional layer of risk. And oxidized LDL is essentially damaged LDL cholesterol. And when LDL particles become oxidized, they're much more likely to trigger inflammation and contribute to plaque formation. So we're looking not only at how much LDL you have, but also its quality of it. And then the LPPLA2, lipoprotein associated phospholipase A2. This marker reflects inflammation that's happening specifically within the blood vessels. Unlike general inflammation markers, this gives us a more focused picture of what's happening inside the arteries themselves. And then the hsCRP, finally, is a marker of whole body inflammation. So inflammation plays a major role in cardiovascular disease, and studies have shown that even people with normal cholesterol may still have elevated cardiovascular risk if inflammation is high. So it's another important piece of the overall picture that we have. And we also check for omega-3 status in the blood test. And even though many people take fish oil, not everyone can absorb or incorporate it equally well. So this omega-3 index measures the amount of EPA and DHA that actually built into your red blood cells, and which gives us better idea of long-term omega-3 status than simply just taking your supplements. All right, so nutrition as medicine. So when we think about preventing heart disease, one of the most powerful tools we have isn't found in a prescription bottle, it's the food we eat every day. The exciting part is that even small, sustainable dietary changes can have meaningful effects on blood pressure, cholesterol, blood sugar, inflammation, and overall cardiovascular health. One of the most well-studied eating pattern is a Mediterranean diet. And this isn't really a diet in the restrictive sense. It's more of a way of eating that emphasizes whole, minimally processed food. So think of plenty of vegetables, fruits, legumes, nuts, whole grains, extra virgin olive oil, fish, and herbs, with some smaller amounts of red meat and processed food. So the landmark PREDIMED trial found that people following a Mediterranean style diet had about a 30% lower risk of major cardiovascular events, including heart attack and stroke. And one reason it's so effective is that it provides healthy fat, fiber, antioxidants, and anti-inflammatory compounds that work together to protect the blood vessels. And another evidence-based approach is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. As the name suggests, it was originally designed to help lower blood pressure, but its benefit extend beyond that. It emphasizes fruit, vegetable, beans, low-fat dairy, lean proteins, and foods that are naturally rich in potassium, magnesium, and calcium, while limiting excess sodium. And many people can see meaningful improvements in blood pressure simply by adopting this eating pattern. And fiber is another nutrient that deserves special attention because most adults don't get enough of it. Fiber helps lower LDL cholesterol by binding cholesterol in the digestive tract, supports healthy blood sugar by slowing glucose absorption, feeds our beneficial gut bacteria, and helps us feel fuller after meals. And research shows that for every additional 10 grams of fiber per day, cardiovascular risk decreases. And great sources include beans, lentils, chia seed, flaxseed, oats, fruits, vegetables, and whole grains. And finally, let's talk about antioxidant-rich food. And so every day, metabolism can naturally produce oxidative stress. And when oxidative stress becomes excessive, it can damage LDL particles and the lining of our blood vessels. And so foods rich in polyphenols, flavonoids, and anthocyanins can help protect against this process. Berries, pomegranate, green tea, dark leafy greens, colorful vegetables, herbs, spices, and extra virgin olive oil are all excellent examples of antioxidant-rich food. And some of the herbal medicine that has been used for centuries to support cardiovascular health. And today we're fortunate to have growing scientific research evaluating many of these traditional remedies. While herbs are not substitute for medications when those are needed, we have evidence supporting their use as part of a comprehensive prevention strategy. So hibiscus tea is one of the best studied examples, and several clinical trials have shown that drinking hibiscus tea regularly can modestly lower blood pressure, particularly in people with mild hypertension. It appears to work in part by helping blood vessels relax and through antioxidant effects that support healthy vascular function. And so for many people, it's an easy and enjoyable addition to their daily routine. And green tea is another beverage with a substantial amount of research behind it. It's rich in compounds called catechins, particularly EGCG, which have antioxidant and anti-inflammatory properties. And studies have associated regular green tea consumption with improved endothelial function, healthier blood vessels, and lower cardiovascular mortality. Even 1 or 2 cups a day may provide all the benefits as part of an overall healthy lifestyle. And rooibos tea also has received amount of attention because it's naturally caffeine free and it also contains unique antioxidants that can help reduce oxidative stress and support vascular health. While the evidence isn't as extensive as it is for green tea, early studies are actually encouraging, and so this is a really good option for people who are sensitive to caffeine. And hawthorn is one of the oldest herbs used for cardiovascular support. Traditionally, it has been used to promote healthy circulation and heart function, and modern research suggests it may help improve blood flow, support mild blood pressure reduction, and enhance the heart's pumping efficiency in certain populations. Although it's generally well tolerated, it can interact with some heart medications, so it's important to use it under the guidance of a healthcare provider. And some of the nutraceuticals for cardiovascular health prevention, you just have to it's important to remember that they're meant to supplement, not replace the healthy lifestyle, nutrition, exercise, sleep, and stress management, because they'll always be the foundation for prevention for cardiovascular disease. When supplements are used, we want them to be targeted, evidence-based, and appropriate for each individual health profile rather than taking a more is better approach. So omega-3 fatty acids are among the most well-studied supplements for heart health. EPA and DHA, which are found in fish oil and algae-based supplements, have shown to lower triglyceride, reduce inflammation, and support healthy blood vessel function. And in some individuals, particularly those with elevated triglyceride, higher dose under medical supervision can also provide additional cardiovascular benefits. And berberine is a plant compound that has gained a lot of attention because it supports several aspects of metabolic health at the same time. And research has shown that it can improve insulin sensitivity, help lower blood sugar, and reduce LDL cholesterol and ApoB in some individuals. And since cardiovascular disease and metabolic health are so closely connected, improving insulin resistance can have a meaningful impact on long-term heart health. And with berberine, we do want to highlight that it can interact with certain medication and affect blood sugar. So again, this should be under the guidance of a healthcare provider. And quercetin is a naturally occurring antioxidant found in foods like onions, apple, berries, and studies suggest that it can also help reduce oxidative stress, support healthy blood vessel function, and also modestly lower blood pressure. And resveratrol, found naturally in grapes and berries, has been studied for its potential effect on healthy aging and cardiovascular health. And it appears to support the endothelial function, the health of the inner lining of our blood vessels, and it can also help reduce inflammation and oxidative stress. And then the red yeast rice. So that is another supplement that's often discussed because it contains naturally occurring compounds called monocolins, one of which is chemically similar to the active ingredient in lovastatin. And it has been shown to effectively lower LDL cholesterol and reduce cardiovascular events in some studies. But because of the amount of active ingredients can vary widely between products, you really want to make sure you get a really good quality red yeast product, red yeast rice product. And then it also can have similar side effects, but not as much as prescription statins, which is why it's also important to discuss with your healthcare providers before starting it. And why blood sugar matters. So when people think about blood sugar, we often think about diabetes, but blood sugar regulation is really a cardiovascular health issue as well. Long before someone develops diabetes, insulin resistance can quietly contribute to inflammation, damage the lining of the blood vessels, and accelerate the plaque buildup. That's why we don't just look at fasting glucose. We also look at markers like fasting insulin and hemoglobin A1C to identify early metabolic changes. And catching insulin resistance early can give us an opportunity to intervene before more serious problems can develop. And encouraging news is that insulin sensitivity often improves with lifestyle changes like regular exercise, eating more fiber and protein, improving your sleep, managing stress, and maintaining a healthy weight. And if exercise were a medication, it would probably be one of the most commonly prescribed because of how many health benefit it offers. Current guidelines recommend at least 150 minutes of moderate intensity exercise each week or 75 minutes of vigorous activity along with resistance training 2 to 3 times per week. I know this can sound overwhelming, but it's okay to start slow as long as you're consistent since every bit of movement counts. And exercise can again improve blood pressure, insulin sensitivity, cholesterol level, circulation, and inflammation. And strength training can help preserve muscle mass, which naturally declines as we age. And it also plays an important role in metabolic health. And stress, we always talk about stress, exercise, and sleep because stress is a normal part of life, and in small amounts, it's actually helpful. The problem is when stress becomes chronic and our bodies stay in fight or flight mode for weeks, months, or even years. And chronic stress can raise blood pressure, increase inflammation, worsen the insulin resistance, and contribute to unhealthy behaviors like poor sleep or emotional eating, all of which can affect cardiovascular health. So managing stress does not have to mean adding another task to your day. Even simple practices like a few minutes of deep breathing, taking a walk outside, spending time with loved ones or in the nature, or practicing mindfulness can really help calm the nervous system. And sleep is one of the pillars of cardiovascular health, yet it's often the first thing we sacrifice when life gets busy. And during sleep, your body repairs tissues, regulates hormones, lowers blood pressure, and resets many of the systems that support heart health. So, too little sleep and consistently poor quality sleep have been linked to higher risk of heart disease, stroke, diabetes, and high blood pressure. So, you want to aim for about 7 to 9 hours of quality sleep each night. And small habits like keeping a consistent sleep schedule, getting more morning sunlight, limiting screen before bed, and addressing issues like sleep apnea can really make a significant difference in both your energy level and long-term cardiovascular health. So measuring blood pressure at home correctly. So blood pressure naturally changes throughout the day, which is why a single reading in the doctor's office doesn't always tell the whole story. In fact, home blood pressure readings often give us a more accurate picture of your usual blood pressure. To get reliable readings, it's important to use proper technique. So you want to sit quietly for about 5 minutes before measuring. Keep both feet flat on the floor, support your arm at heart level, and avoid talking during the measurement. Taking 2 or 3 readings and averaging them is much more helpful than relying on a single number. And we also recommend checking your blood pressure in the morning and evening for about a week before an appointment if you're monitoring treatment or evaluating your risk. Looking at trends over time is very valuable than focusing on one isolated reading. So, at Sklar Center, our approach is to identify cardiovascular risk before it becomes cardiovascular disease. Rather than waiting for symptoms or an event like a heart attack, we focus on finding early signs of imbalance that we can actually do something about. We start by looking at the whole picture, not just cholesterol, but inflammation, metabolic health, genetics when appropriate, lifestyle habits, and advanced cardiovascular biomarkers. And this can help us identify root causes and personalize recommendations instead of using the same approach for everyone. From there, we create a plan that can help, that can include nutrition, exercise, stress management, sleep optimization, targeted supplements, and medications when they're appropriate. And most importantly, we continue to monitor progress over time. Prevention isn't a one-time visit, it's an ongoing partnership focused on helping you stay healthy, active, and feeling your best for years to come. All right, so for this month, rather than trying to change everything at once, I encourage you to choose 1 or 2 habits to focus on this month. Prevention isn't built on perfection, it's built on consistency. So small actions repeated over time can have a powerful impact on blood pressure, cholesterol, inflammation, blood sugar, and overall cardiovascular health. So think of these habits as investment in your future self. Every healthy meal, every walk, every good night's sleep, and every moment spent managing stress can contribute to protecting both your heart and your longevity. And focus on building sustainable routines that can maintain long after today's webinar. Alrighty. So for our next webinar, it will be in August and we'll focus on regenerative and anti-aging therapies. And thank you for joining, everyone.